Prolonged sitting leads to reduced nitric oxide production, causing vessels to stiffen and impacting your overall health. Adrenaline stimulates alpha-1 receptors, causing peripheral vasoconstriction and narrowing the blood vessels. Decoding atherosclerosis plaque, oxidized LDLC, the process of creating an injury and plaque accumulation in the artery wall.
Decoding salt and blood pressure. Why does sodium retain water and increase blood volume, pressuring blood vessel walls?
Fructose, causing inflammation, damaging the endothelial layer where atherosclerosis begins. Decoding abdominal obesity and blood pressure. Visceral fat releasing inflammatory cytokines and causing insulin resistance, driving BP up. Nicotine stimulates the sympathetic nervous system, leading to immediate blood pressure increases and vessel wall damage.
Brisk walking trial, measuring increased nitric oxide production and reduced arterial stiffness.
Experiment diet. Reduced sodium. Analyzing blood pressure reduction after 30 days of application. Why do anti-inflammatory drugs cause fluid retention and reduce the effectiveness of blood pressure medications?
In the intricate dance of cellular biology, the sodium-potassium pump plays a pivotal role in maintaining cellular homeostasis.
Decoding moderate alcohol consumption and heart health.
Decoding atrial fibrillation, or AFib, the electrical storm. Why do the atria contract chaotically, causing stroke risk?
The heart is dilated or stiff. The heart no longer pumps effectively. Decoding angina chest pain. When does atherosclerotic plaque block oxygen supply? Repeated oxygen deprivation activates a stress response, raising nighttime blood pressure.
Isometric resistance training involves holding a static position, like this bicep curl.
Using CPAP or a ventilator to treat obstructive sleep apnea can significantly reduce nighttime blood pressure and decrease cardiovascular risk.
Stress and inflammation from sleep loss irritating the heart's electrical pathways.
Repeated oxygen deprivation activates a stress response, raising nighttime blood pressure. Electrolyte imbalance causing dangerous cardiac arrhythmias. Decoding extreme exercise and heart failure, ultra-high intensity training causing myocardial fibrosis and arrhythmia. And
decoding sleep overdose and heart disease. Is sleeping over 9 hours a sign of underlying cardiovascular disorder? Decoding the habit of eating lots of canned and frozen foods, hidden sodium and preservatives are increasing cardiovascular burden.
Broken heart syndrome can temporarily weaken the heart.
So what we want to do is light endurance training for heart failure.
Decoding fish oil omega-3 supplementation and AFib. Fatty acids stabilizing cardiac cell membranes, reducing arrhythmia. Decoding the habit of standing up too quickly. Hypotension, slow baroreflex causing dizziness, dangerous for heart failure patients.
We're working on bed mobility exercises to prevent deep vein thrombosis.
Decoding diuretics and exercise. Risk of dehydration and electrolyte imbalance during high-intensity training. Diaphragmatic breathing therapy for heart failure. increasing negative intrathoracic pressure, aiding heart unloading.
Decoding moderate coffee consumption. Does caffeine trigger AFib in all patients?
Decoding ischemic stroke, the blood clot. When does plaque or a clot from the heart block a brain artery? Blood clots often form in the left atrium and travel to the brain.
Digs for Biome. Decoding sleep deprivation and stroke risk. Lack of sleep increases blood viscosity and the risk of clot formation.
Decoding the habit of chronic dehydration. Can excessive muscle tension compress the vertebral artery?
Decoding the habit of self-massaging the neck. Can forceful neck massage cause carotid dissection? Decoding silent stroke. Brain damage occurring without symptoms due to small vessel blockage. Decoding the habit of eating lots of processed red meat. Prolonged immobility, such as during long flights or extended sitting, can significantly increase your risk of deep vein thrombosis.
Experiment. Deep breathing and eye closure technique. Stimulating the vagus nerve to reduce heart rate and stabilize blood pressure. High-intensity repetition exercises rebuild brain connections.
Hydration rule. Consistent water intake leads to reduced blood viscosity and blood pressure. Decoding overuse of antiplatelet drugs. Why can unilaterally increasing the dose cause hemorrhagic stroke?
Cervical stretching. Reducing neck muscle tension, improving cerebral blood flow.
Decoding the habit of sudden cold water immersion, causing abrupt peripheral vasoconstriction, increasing heart pressure and stroke risk in those with underlying conditions.
Experiment, 20-minute nap and cognitive performance, reducing daytime stress, indirectly lowering blood pressure.
Decoding high-intensity exercise after stroke. When is it safe and when is it dangerous?
Ankle pumping technique. Preventing DVT or thrombosis during prolonged sitting.
Decoding the golden hour after stroke. Why must thrombolysis treatment be extremely fast?
Bacteria from the gums entering the bloodstream and causing vascular inflammation.
Decoding sleep deprivation and overeating fat. Lack of sleep increasing ghrelin, the hunger hormone, and driving harmful food choices. Short nap for hypertensive patients, reducing overall daytime blood pressure burden. Music therapy and blood pressure, reducing cortisol, promoting vasodilation. Weakened kidneys unable to control fluid and RAAS, causing difficult to treat high blood pressure. Decoding the habit of skipping breakfast and heart health. Skipping meals increases inflammation and insulin resistance, harming blood vessels. Experiment. Diuretic breathing technique to reduce edema, increasing negative intrathoracic pressure to aid venous return to the heart.
Optimal exercise timing for hypertension. Does morning, afternoon, or evening exercise provide the best BP reduction?
Simple arm and leg exercises.
After stroke, preventing muscle spasticity.
Lack of sleep increases sympathetic activity, pushing calcium into vessel walls. experiment. Sleeping on an inclined mattress for heart failure. Optimizing sleeping posture to reduce pulmonary edema and nighttime dyspnea. Decoding the habit of eating hot pot, salty broth. Massive sodium intake, causing acute heartburn.
Experiment. Inspiratory muscle training for heart failure. Improving lung capacity.
Decoding the habit of ignoring mild chest pain. Angina symptoms potentially confused with indigestion.
Experiment. CoQ10 supplementation and heart failure. CoQ110 boosting energy for cardiac muscle cells. Decoding sleep deprivation and insulin resistance, the link between metabolic disorder and cardiovascular disease.
This can help strengthen the muscles in your chest and arms, and it also aids in improving circulation.
Good, good. Keep that up.
Decoding stress and sleep loss causing numb hands. Peripheral vasoconstriction due to stress and poor sleep posture.
Whole foods diet and cholesterol reduction. Increased soluble fiber to eliminate cholesterol. Excessive hypotension, overly low blood pressure, can cause ischemic stroke due to hypoperfusion, reduced blood flow to the brain.
Warm bath therapy and vasodilation. Peripheral vasodilation. Reducing BP.
Eating too late increases triglyceride and glucose levels overnight.
At-home BP monitoring. Measuring morning and evening BP helps detect non-dipping, allowing us to adjust medication.
Decoding the habit of drinking lots of fruit juice.
Experiment. Light aerobic training for stroke. Improving cardiovascular function and cerebral circulation.
High blood sugar. It's the leading cause of atherosclerosis and heart failure.
Experiment. Mirror therapy after stroke. Reactivating the brain for paralyzed limbs.
Decoding sleep deprivation and post-stroke inflammation. Lack of sleep increasing secondary brain damage from inflammation. Mediterranean diet model. Reducing inflammation, improving cholesterol, and endothelial function.
Today, we're going to talk about athlete's heart and how to distinguish it from a truly pathological condition. Experiment. Sleep healing therapy. Optimizing the sleep environment to reduce stress and promote cardiovascular recovery.